Hi, this is Terry Kuti, founder and director of DiepCFoundation. I'm very honored today to have with me again Dr. Patricia Clark, who is from Ironwood Cancer Center in Scottsdale, Scottsdale, correct?
Scottsdale, Arizona.
Okay, I never know whether to say Scottsdale or Phoenix, but you're in Scottsdale.
I'm in Scottsdale.
Yes, okay, Scottsdale, Arizona. Dr. Clark and I just wrapped up a wonderful 2-day conference called the BC3 Conference, and it actually stands for Breast Cancer Coordinated Care. Phenomenal conference for both of us. I'm a little talked out. I think we all are.
Yes.
It was a phenomenal conference for me as a patient advocate to engage with all of the attendees. So I'm going to let Dr. Clark tell you about what the meaning behind the BC3 conference is and really the takeaway from it. So take it away.
Okay.
Yeah.
So the BC3 conference is probably one of my favorite conferences, and some of the pivotal turning points in my career came as a result of this conference. It started about, I think 2011 is when it started. And the thing that was revolutionary about this conference was it brought together plastic surgeons, radiation oncologists, and breast surgeons together. And all three of these disciplines are involved in local control of the breast. We're kind of in a new golden age in breast surgery where oncologically we've discovered a lot with the innovations in genetic profiling,
Yes.
DNA, molecular genetics. Our survival rates are so much higher. Our treatments are so much less morbid, targeted. We're in the era of precision medicine. When I first started my breast surgery career, actually when I was a general surgery resident, I hated breast surgery, and I hated it because we would just make an incision over the tumor. We would take the tumor out, we'd sew the skin up. We made no effort to reconstruct the lumpectomy defects. Everybody who had a tumor over a centimeter got chemotherapy. And I just felt like I was disfiguring women. There was no anatomy. That all changed.
The aesthetics was the missing piece of the puzzle.
The aesthetics was, and the long-term survivorship and the whole patient wasn't our main focus. We were looking at our little piece. There's the tumor, take it out. We want this big a margin, give them chemo, radiation, and our algorithm just didn't branch very deeply. With all of the technological and surgical innovations that we have, we're capable of doing so much more. What was really revolutionary in BC3 for me was 10 years ago, oncoplastic surgery wasn't widely adopted in the United States. Oncoplastic surgery is combining plastic surgery techniques with surgical oncology to not only treat the tumors and do an oncologically sound procedure, but also prevent the deformities and restore the form and function to the breast.
Right.
That word was coined in the 80s by Werner Aldrich in Germany.
Didn't know that.
Yes, and not in the UK, but in Europe, the French, the Germans, the Italians, they all started to incorporate these procedures together to improve the quality of breast surgery. In the US, over the last 15 or so years, it slowly gained traction. Now we're running full blast ahead to catch up with Europe and catch up with South America.
And I noticed that at the breast surgeons conference last year.
Mm-hmm.
I gained a lot of information about what you're talking about.
Yeah. So BC3 was the first conference that brought all of these disciplines together under one roof, where we actually sat there and watched each other's sessions.
Mm-hmm.
So for instance, when I was watching a radiation oncology session, I saw the way they were planning the radiation and the way they were aiming the tangents, and I didn't really understand it with that granularity. They were showing what the effect of a breast implant upon a radiation field was. I didn't understand that. So I started to rethink a little bit, how I was planning these surgeries. And then the plastic surgeons, it was interesting. Some of the breast surgeons showed their oncoplastic work, and the plastic surgeons showed their work. And I'm proud of the breast surgeons. The breast surgeons showed some pretty darn nice results.
Yes, they
And
did.
yeah, so we've come to these meeting points where we're seeing each other as peers, and I'm telling my plastic surgeons these are my oncologic considerations, and they're showing me, when I make this incision here, they're teaching me their aesthetic considerations, to where now we have this overlap of collaboration, and we've advanced the science so far. One of the things that was discussed at this meeting today that I'm really excited about, we do nipple-sparing mastectomies. 10 years ago, we weren't doing that many of them. Now we're trying to do them in virtually everybody. In nipple-sparing mastectomies, one of the problems is the nipples are numb. They're really ornamental. Dr. Pellet and her husband showed their work, which they're up to about 90 patients now, where they've been doing nerve grafts to restore the nipple sensation to that nipple to where it has enough sensitivity that it even has erotic function.
Yeah, that was an amazing presentation this morning. Do you want to do a separate video on that?
We will.
Okay,
Yeah.
So let's wrap this one up.
Yeah.
And here's what I want to say.
Yeah.
In conclusion to what you said and what I observed. What I really liked and what I saw firsthand at this conference, to those viewers and to a patient like me, I saw doctors conversing and collaborating with each other and learning from each other. To me, that was the most profound observation for me to watch, and to see you guys bouncing things off of each other in a very inviting way. So we're going to wrap this one up. That's basically what BC is about. Yeah. All of these specialties getting together. I was treated by my breast surgeon, by my radiologist, by my plastic surgeon. These guys were all together this weekend learning from each other. We're going to wrap this video up, and we'll do another one on the nipple.
Okay.
That
sounds great.
Okay. Thank you.